afternoon. This is Shanna Dethi here live at the Digital Health Studio at CES 2019. I'm here with John Jenkins, MD, and he is the Chief Clinical Officer of Connected Care with Cone Health from North Carolina, you said,
Yes,
right?
Yes.
And you are here with Wellsmith on a panel. Do you want to tell me a little bit about what you're doing?
Sure. So Wellsmith was presenting about waypoints, about how we use digital reminders with our digital peripheral devices through a platform to engage people in management of their diabetes and to produce some pretty incredible results to help physicians like me to get patients better managed with better results and better outcomes, not having to go to the hospital as often, not having to go to the doctor's office as often,
Right.
and hopefully not having poor outcomes like neuropathies or conditions that get people hospitalized.
Right, so we were learning a little bit about what they can do with neuropathies. So what do you think on the patient side, right? What are you seeing as you're starting to put in and integrate this stuff? So I'm assuming that your health system is using a platform like Wellsmith. What have you seen as far as the improvement in outcomes today?
So one of the problems that we have as physicians is that we only see you in little snippets of time. And we may spend 7 or 8 minutes with you, and then we say, come back in 6 months or a year. What Wellsmith allows me to do as a physician is to engage you daily in your health. So we see the outcomes of your glucoses, we see the outcomes of your weights, we see the outcomes of your activity, and then we can share guidance with you as to, hey, do you see how this connects? Do you see what this results in better glucoses for you when you take a little more activity, when you eat a little less carbohydrate, when you follow the medication plan the way it's scheduled? And then more importantly, what if there needs to be a change? How do I get the data, that digital conduit of data to me, so that I can feel confident in changing your care plan in real time to produce better outcomes?
That's just fascinating. So since this is something that's, I'm assuming, is relatively new, not the technology itself, but the way we're starting to integrate it into health systems, what do you think is the future of this space? And do you think we're going to see more and more and more of this adoption and change within putting the patient more, but with the doctor at the center of their own care?
Sure. Well, chronic management of disease is something that we all struggle with. Not only do we struggle with it from an access standpoint, if you have a chronic condition and you try to get that appointment with your doctor, you sometimes struggle to get it in the time frame that you need to have that appointment.
Right.
And also to understand when you reach a problem, having to wait until you can contact the doctor's office to be able to solve that problem. And then how do you know and get the reinforcement that you're on the right track? The Wellsmith platform allows us to accomplish those three things. So we have real-time interaction through the platform. We have reminders that are automated through the platform, giving you kudos for doing what you should do and reinforcements for having a healthy day. And then if you get in trouble, we can make that referral to the doctor's office and augment your ability to get in them in a timely manner.
Great. So do you see any barriers to this rolling out in a much bigger way across the United States?
So, of course, reimbursement is the pain of all healthcare.
Right.
Because we are reimbursed on a very archaic system for fee-for-service. And so we have to get into that risk space, whether it's with a Medicare patient population or even with a risk contract with an insurer, so that we can be responsible partners with you to manage your health together, and then we can use some of these innovative, cost-effective means to change the outcomes of health.
Yeah, so talking about that really quickly and the reimbursement space, are you seeing the ability for these types of programs and stuff being more adopted quickly from the self-insured side, where
Sure.
they already are taking part of the risk already with their employee populations? So
digital health is one of the great equalizers of access, because we can provide healthcare at a cost that allows you, who may have a high deductible plan or no insurance at all, to afford a digital health visit if it's only $30 or $35 or $40. And so I'm really excited about how that changes the way we do things. Also, when you look at Cone Health, we're a 6-hospital system in the middle of the state of North Carolina, and about 50% of our current contracts with insurers are at full risk.
Wow, that's pretty impressive.
Yeah.
Well, thank you so much for joining us here
Glad
today
to
and
be
telling
here.
us a little bit more about what you've been doing, and we appreciate it.
Thank you so much.
And this is Shanna Dethi here at the Digital Health Studio, live at CES 2019, hosted by Living in Digital Times.